Howdy everyone, Matt and Mateo here. We're coming at you with another orthopedic special test, and this one is for the ankle and ankle instability specifically. It's the anterior drawer test. So I remember learning this one back in school to look at the anterior talofibular ligament to see if it was torn, but you can also use this for checking chronic instability of the ankle. So for the history of it, I couldn't find exactly when this test was developed, but I will tell you, looking in through some articles, I did find one from 1975 that did talk about some of the previous research, and that, there was a paper in the 30s, one in the 40s, one in the 50s, that did talk about establishing the stability in the ankle, finding that the ATFL was, was very important in that, and then also some in looking at the translation of the talus. So the one in 1952 did find that looking at 20 degrees of plantar flexion did add more translation, or allow the talus to translate a little more. So possibly the test probably came around then. So how do we do this test? So I'll show you the way that is taught. I'll show you a way that I was taught, and maybe even a little modification. So we're going to have Mateo here on the table. So you have the person lay up on the table with the feet sticking off. We are first going to look at the non-affected side. So you test the non-affected, then the affected side. I don't like saying good and bad. I like saying affected, non-affected. So we stabilize the tib fib, the other hand grabbing the calcaneus through there. So nice little comfortable grip on it. About 20 degrees of plantar flexion, so Mateo's a little stiff. And then a little anterior translation through here. Pull a little forward here. And we just remark how much motion we get. Then we test the affected side. Now the way I was taught is a little variation of it. So using a Nordic wedge, have the person place their foot up on the wedge here, stabilize the foot, and then translate that tibia backwards. And then we're remarking right there in the talus, or that distal malleolus area, and just seeing how much translation that we get there. So the research behind this, there is not a lot about the reliability and the validity of this test. They did find that this test is pretty specific. So I would take that to mean, they didn't really explain it in here, but I would take the mean to say, like, if you don't have a lot of laxity in it, you probably are not unstable in the ankle. They did find that it was also pretty reliable, looking at each side. So, if it's more lax on one side versus the other side, yes, probably have chronic instability. They did talk about interrelated reliability between, specifically, they said junior and senior examiners. So you could take this to say, if you happen to have, the people that are doing this are not as experienced, they may not find the same things as somebody who is more experienced. But they did a little variation and found that they were able to kind of get that, that interrelated reliability a little bit better. And what they did is that they supported the tib through here. So very similar, same thing. And they did it like through here. And they found that this was a little bit more reliable between examiners based upon experience. So there you go. That's the anterior drawer test looking at ankle instability. So let me know, what do you think of this test? Do you utilize it? Do you think it's a good test, or anything like that? So just share them down in the comments below. And of course, if you have anything else that you are kind of curious about, always happy to do videos on those. And like I always say, take care of yourself, take care of your patients. We will see you next time.